Hey all, today I'm 9 weeks post-op top surgery, which I had on September 23rd with Maud Belanger in Montreal. And I wanted to talk today about one of the most contentious subjects when it comes to top surgery, which is smoking cigarettes. Smoking cigarettes. Because, I mean, you gotta be specific. But anyways, nicotine constricts the blood vessels, and especially the capillaries, which are the tiniest ones and closest to the top of the skin and all that important stuff. The thing is that when surgeons prepare their lists of do's and don'ts, they have to tailor that to the lowest common denominator. So for every surgery, every surgeon tells you not to smoke before or after the surgery because of potential complications with blood flow and healing. So when it comes to double incision and you have nipple grafts, like I had, so when they take the graft off, or the nipple off or whatever, like there's a higher chance that it could die either way. So I seen this discussion brought up in a group that I'm on Facebook that has to do with top surgery, and you know, it's a lot of guys, they're very vehement when it comes to not smoking. Like if someone says, should I quit or blah blah blah, it's very aggressively, yes, you should quit. Why would you be so stupid as to smoke and potentially damage your results and all this blah blah blah. There's this real atmosphere of don't fucking smoke cigarettes if you want to have a nice looking chest, especially if you want to keep both your nipples. So I have had a number of different surgeries over my life. I had, 2 on my nose. I had my tonsils removed. I can't talk today. I had an abdominal hysterectomy 5 years ago. So I've been around the block. I've smoked since I was 12. So the amount of nicotine that's in my body and constricting my blood vessels would not change during, 2 months ago when I had surgery. So I took it upon myself to cut back in the month prior. I went down to like a little less than half a pack a day. And when I was up there in Montreal, I made sure that I had a pack of Nicorette with me in case I couldn't sneak by the nurses and get outside. And all I did was tell them I was going for a walk or whatever. Like, they encourage you to get outside. There's this beautiful park across the road full of ducks and a big river, and like I would just go across the street and sit on a bench and look at the ducks and smoke. And if I didn't feel like getting out of bed or whatever at night, I'd just pop a Nicorette. So and I mean, I didn't have any complications. Healing, I didn't find that my healing was slowed down at all. I heal pretty quick anyway, and as you can see, I still have 2 nipples. There was no problems with them at all. I mean, like when I took the little dressings off, they're just Tegaderm patches, which is a big sticky sheet, and there's some gauze pads over the nipples is what Belanger does. There's none of those yellow popcorn sponges or whatever, which is good, because that just made me queasy looking at those. But anyways, as long as you're conscientious about the amount of nicotine that you're smoking and you're conscientious of your own limitations, then by all means, smoke, continue, do whatever. You don't have to quit, necessarily. Yes, be honest with the surgeon and the anesthesiologist when they ask you if you smoke. Say yes. They're not going to cancel the surgery. So they just need to know. So be honest, be upfront, and like just be reasonable. And that goes with everything too, not just smoking. Like, be reasonable with everything. Your movements, your weightlifting, all that stuff post-op. So I just wanted to mention that. I mean, if anybody has any questions, feel free to leave a comment, and let's be more open about smoking cigarettes and still having top surgery that we're really proud of. So, I'll talk to you guys later.